It's Gary Chimes from Lake Washington Sports and Spine, and what I want to talk about is my perception on the differences between Canadian healthcare and US healthcare and how Canadian patients can use that to their advantage. So one of the things I want to think about is the floor and the ceiling for how good your care can be. So the floor is how good our circumstances in a worst case scenario, and the ceiling is how good are your circumstances in the best case scenario. And in my opinion, when you're working with the Canadian healthcare system, what it's really designed to do is make your floor as good as possible. So if you're somebody who is destitute, doesn't have a lot of resources, and something really bad happens to you, in the Canadian model, you tend to do fairly well because the resources that are available to people without a lot of resources are good. In my opinion though, that same process, what it does is it lowers down the ceiling of how good your care can be, because in order to make those resources available to everybody, there's certain things they don't offer to anybody. And also what it does is it minimizes variance. So the difference between the worst care and the best care is actually fairly tight in Canada. If we compare that to the United States model, the situation is that the worst case scenario in the United States can be pretty bad. You may not get good care, you may not get care at all, or it might be very expensive to the point where it puts you into life-altering debt. The ceiling though in the United States is actually quite good in that there's a lot of tools that are available to you, there's a lot of innovation going on in the United States, and if you don't like what you're getting, you have the option to go somewhere else, and what that does is it creates more variance. Now, for people in the United States, this is kind of what you got going on. I mean, there's different systems like the VA system or Medicare where they try to sort of simulate more of a Canadian model, but for the most part in the United States, you don't have the choice to go to the Canadian model. But if you live in Canada and this model isn't working for you, you are allowed to cross the border to go into the United States and take advantage of the higher ceiling if you know where to go. And that's something that we think is really important for patients who, let's say you live in Vancouver and you're finding that you aren't getting access to some things that you think would be valuable to you, such as regenerative medicine techniques that we do in our clinic. You can just drive across the border and get what you need. So I think understanding the differences between the way the Canadian model and the US model can be very advantageous to the savvy Canadian consumer. So this is Gary Chimes at Lake Washington Sports and Spine.